Good morning. We'll do that one more time. Good morning. We are gathered here to address one of the great social challenges of the early 21st century, caring for aging populations. This challenge comes on the heels of an unprecedented increase in life expectancy in the 20th century. An American born in 1900 had a life expectancy of 47 years. By 2000, it was 75. Today, it is 78. In many parts of the world, the gains have been even greater. For example, in Japan, life expectancy has nearly doubled in just one century. Consequently, today, 50 million Americans are over 65. By 2025, over 70 million will be. Among these Americans are about 1 million with Parkinson's disease and over 5 million with Alzheimer's disease. Globally, the challenges are even greater. In 10 years, the number of Chinese over 65 will exceed 200 million. Beyond these numbers, these conditions and others associated with aging affect nearly all of us directly as individuals or as caregivers. This social challenge will require health, technology, financial, and policy solutions. Fortunately, among you in this room today are leaders in each of these fields. One output from this summit will be policy recommendations for the next President of the United States to enable aging at home. If you'd like to share your ideas or recommendations, please take the cards that you received at check-in and return them to us in the back. We hope that this will form the basis of a policy debate during the upcoming presidential campaign. This summit is focused on aging in place. 88% of Americans want to live at home for as long as possible. To meet this goal, we will share today's best ideas, form tomorrow's partnerships, and create disruptive care models of the future. This summit would not have been possible without outstanding contributions from our d.health advisory board, valuable partners, and 2 dedicated women. If you're excited to hear our speakers or learn new ideas today, please thank our d.health advisory board, Senator Tom Daschle, Nancy Green, Healthcare Global Lead for Verizon, David Klein, Special Assistant to the CEO of the University of Rochester Medical Center, Bruce Leff, Professor of Medicine at Johns Hopkins, Phil Levinson, a Venture Advisor at Learn Capital, Carol Raphael, Chair of the Board at AARP, Joe Smith, CEO of Reflexion Health, Seth Sternberg, CEO of Honor, and Avivian Soufian, a former policy advisor and consultant. Several of those individuals are here. Could you stand up if you're on our d.health advisory board to be recognized? Carol, Bruce, Phil. If you like this unique event, the setting and the accommodations, please thank our partners: the University of Rochester Medical Center, the University of Rochester Simon School, Lundbeck Pharmaceuticals, Johns Hopkins, Stoli, Verizon, the West Foundation, the West Health Institute, American Well, Genworth, the V&A Health Group, Grand Rounds, Touch Care, Teva, MC10, and the Gergen Institute for Data Science. As a summit organized by academics, we rely on you and our partners to produce this summit focused on ideas, partnerships, and policy solutions. If you like everything you see, the program, the website, banners, please thank Monica Perino and her team at Brand & Butter. If you like everything you do not see, the organization, the process, the logistics, please thank Anna Stevenson and her team at the University of Rochester. To begin our d.health Summit, we could not have a better opening speaker than Stephen Johnston. Along with Dr. Katie Fike, Stephen Johnston is the co-founder of Aging2.0, a global innovation platform that is accelerating innovation to improve the lives of older adults around the world. Together with its sister organization, Generation Ventures, an early-stage fund focused on aging, the new ventures have developed an ecosystem of entrepreneurs, technologists, investors, and seniors to transform aging globally. Today, that ecosystem includes all of you. Stephen graduated from Cambridge University and Harvard Business School, speaks about 10 languages, and I'm told dances like no one else. Please join me in welcoming Stephen Johnston.
ambitious intro. Wonderful to be here. Wonderful to be back in New York. And thank you, Avi and Ray, for this opportunity. It's a view like this you just don't get in San Francisco. And so far, I'm having a wonderful time back here in New York. So I'm going to kick things off and really just keep things simple. It's early in the morning. We haven't all had multiple cups of coffee. So just two messages that I'm going to be delivering. One is the concept of super aging, which, as Ray was saying, is really something that requires a whole new approach. Second, this idea around the market. What is this market opportunity around aging? And really the sort of proposition I'm going to talk about is that aging is living. It's not a market segment. And then, because I want you all to do the work, and I'm just fascinated and amazed by the people in this conference, I've got 3 questions that hopefully you can help discuss and you can help answer. Sound good? All right, so super aging requires a new approach. And this is really just a way to kick things off, which is a bit of background as to where I started from. So I am not a gerontologist, a physician, a scientist, or a geriatrician. I got started in the technology world and spent quite a bit of time at Nokia working on things like mobile health policies, where they were starting to do really interesting things, taking connectivity into Africa and India and seeing remarkable impacts of connectivity and mobile technology to improve the lives of people. And that got me really excited and empowered by the idea of what mobile technology could do. I then ended up coming to New York and working for a very wealthy man who unfortunately got diagnosed with dementia. And there was very little available for the family to help. And there was this really interesting case where somebody with tons of resources just did not have opportunities to get products and services to help improve the quality of their lives. And this struck me as really important and significant, and something that I spent quite a bit of time looking at. The way the world is moving now is quite unprecedented. This concept of the demographic change, this unprecedented shift in demographics is something that we haven't seen before. There's a piece here in the FT that describes super aging, which is the concept of a country that has more than 20% of its population over 65. Just 3 countries so far have that distinction, but there's going to be 34 of them by 2030. Super aging, I think, is a pretty cool name, actually, and all sounds a bit boring and demographic. And I think the interesting implications for us is that it's not just that there's more older people around, it's the fact that the rate in which our societies are aging is happening that much quicker. So it took France 115 years for its population of people over 65 to double from 7% to 14%. And that is now rapidly getting quicker and quicker. The cycle time for aging of our economies is so much quicker. Now it's going to take Korea just 18 years to have that really quick distinction. And obviously the big issue is going to be those countries like China and the developing countries which are aging before they grow rich. So lots of implications for this in terms of a global topic, but it's also interesting for the US. This was a comment that one of our speakers made last year, which I thought was right on. It was a little harsh, but I think that's what we're all here to do. America is a great country to be young in, but not really a great country to grow old in. And I think that's what we're here trying to sort of look at and understand, some of the implications that could occur, and I think we're already seeing occur with this unprecedented demographic shift. And McKinsey just came out with this interesting report that just because of the demographic slowdown, we're going to see a 40% reduction in GDP growth over the next half century, even if we keep productivity the same way as it is today. Many of you here are experts in the healthcare budget issues, and the idea that we can keep accelerating the percentage of GDP we spend on healthcare is obviously a big challenge and something that we need to address. When I'm in Europe, one of the things that came out the last couple of years really strongly, and now increasingly the case here in the conversation, is this concept of social inequality. In the UK, they recently did a study that there's a 10-year life expectancy difference depending on how wealthy you are. And I think here in America, we have some interesting conversations happening in California and Silicon Valley, where you have very wealthy venture capitalists deciding that, as Peter Thiel said just the other day, the biggest inequality that we need to address is the difference between those who are living and those who are dead. So there's a lot of people with a lot of money deciding that actually the most important thing for them to do is to live forever. This is not really something that I'm necessarily focused on, but I think we can do a lot of work in the short term to help people have a better quality of life. There's other issues. I don't want to make this a bleak start to your morning, but I think the point here is that there's a lot of challenges and opportunities coming up, and this is really why we set up Aging 2.0. So just a couple of words on Aging 2.0. Has anybody been to an Aging 2.0 event here in the back? A couple of folks. Excellent. So it's good. A smattering. Aging 2.0 is really a different take on aging. It's exemplified by sort of these concepts of, if you ask most people about aging and what aging means, they will often come up with somewhat negative and stereotyped words, things like it's all about medical issues, it's all about decrepitude, it's about negativity, it's about loss and failure. And this is something that we're radically changing, or trying to change the notion, the mindset. And it really does start with a mindset and a point of view. So shifting from a slow mentality to a fast internet speed cycle time is shifting from this sort of negative perceptions to a positive opportunity-driven approach. It's shifting from localized solutions to international ones, in particular learning from the best ideas around the world. We've got people here in this country this room from all different countries. It's fantastic, and it's something that Aging 2.0 is trying to bring in. And as William Gibson said, let's learn. The future is here. It's just unevenly distributed. Similarly, in terms of the silos, and for those in the healthcare space, you can probably talk at length about the challenge of silos and the need for interoperability, and this idea of intergenerational engagement as well is something that's the core of what we do. So we don't want to just have communities siphoned off into these ghettos of younger people and older people, but actually the barriers connecting the generations is actually much higher than it is between genders and races, for example. So we're a global innovation platform with a mission to improve the lives of older adults around the world. We're doing that with technology innovation. It's probably best exemplified by a wonderful June Fisher, who's our Chief Elder Executive. This is a title that we made up to really exemplify the kind of person that we're excited to be working with. So June is a local San Francisco resident. She heard about what we were doing in the San Francisco Chronicle, walked up to the office and banged on the door and said, "You need me to be part of what you do." And we actually did, because I, at 43, was then the oldest person on the team, and we really need to embrace what we're talking about, which is intergenerational engagement, and having people like June, who's a physician, a doctor, a designer, and somebody with tons of ideas at our fingertips is fantastic. And she was saying how she has a real problem because she loves these tomatoes that are on sale at the fisherman's in San Francisco in the market there, but then she was going to go and pick up these tomatoes, but she couldn't go because she had her ski poles and her walkers, and she couldn't also manage her shopping basket. And so she was just really frustrated and telling everybody who she could about this. And luckily, she also happened to get engaged with Stanford Design Challenge, which is the group we've been partnering with for the last couple of years. A bunch of smart students at San Francisco State set this as a challenge and said, okay, June, let's solve June's problem. Let's go and design an awesome solution to help June get her tomatoes. So they designed this brilliant cart, which actually won first place just last month in the Stanford Design Challenge, and hopefully we'll be able to take this into providers like Medline or Direct Supply or some distributors and get this, because it's a cool-looking device that I would be quite happy to take around to get my shopping done as well. And June is a very happy camper. So we have chapters around the world. This is our active Taiwan chapter. The thing that we're doing quite actively is having local pitch events, and our New York ambassador, Crispin, at the back is hosting an event on the May 19th. We've got about 40 of these events, and what we're trying to do with these events in the next couple of months is just to get and get in touch with all the local experts of innovations around the world and get them to bubble up, come to our conference in October in San Francisco. So this idea of a global conversation, a global innovation conversation, is something that we haven't seen happen before in aging. We're delighted to be part of that conversation. So the second piece is about this idea of the market segment, and it's really interesting and topical right now to talk about aging as a massive business opportunity. And there's a lot of good work, including done by Jeff at the back from AARP, who just released a wonderful report called Caregiving and Technology. Economists in Prudential, McKinsey just came out in the last couple of weeks with really interesting reports, well worth having a look at them. These slides will be available if you want the links. All of them are really thoughtful pieces describing how there's just an inevitable increase in the business opportunity connected with the demographic shifts. The 1 billion people, the new emerging market, as McKinsey is calling it, identifying it as the most important consumer group of all the consumer groups over the next few years, from 2015 to 2030. So what actually is the market, and how do we access it, and who is going to be making money and who is winning is a question that a lot of entrepreneurs and a lot of people are thinking about. So one way to think about it is that there is a sort of continuum of markets as we think about aging, from really sort of the health and wellness to the more acute care. So the one we could be talking about sort of these three different categories. You've got aging in community, this great big, bold vision that we here are all trying to work towards and is very much held up in as a goal for good reasons by governments, businesses, policymakers, innovators around the world, because we cannot house all of the people who are growing old in the traditional senior living communities. There is then this continuum of care between aging in the community, residential, post-acute, and acute care. In a broad sense, we can sort of look at these as three different markets, where the consumer tech world is probably most active in the aging community space. The aging and senior care, a lot of the residential communities, Welltower here is a great example. And then on the acute care and on healthcare and hospital systems. Some great innovations are happening in each of these areas. They're sort of all combining to try and work together to identify what it means to improve the lives of these people looking to get old and get healthy and stay healthy. Amazon, for example, just one answer. Apple Care Kit could be another in the tech world, who are increasingly delivering products and services that, if you look at them, they're not labeled aging. They don't have big buttons. They don't have a obvious sort of marketing brand that this is for your elderly relative. But actually, it's really good. Has anybody used the Echo? Any big fans? It's just one of those things that just works really well. It's voice activated. You can increasingly start to control your entire house and lots of different interconnections and different services. This is going to be a product to watch. On the aging community side, Brookdale, which is another one of our partners, in addition to Welltower, has just kicked off this very cool thing called the Entrepreneur in Senior Residence. So the Entrepreneur in Residence is a well-known concept in Silicon Valley. So why not have young entrepreneurs or old entrepreneurs who want to come up with new ideas working and living in senior communities and engaging with the residents and developing ideas together, as June would say, developing with, not for, older people. And then on the acute care side, there's no shortage of interesting innovations. Just mention this, what I thought was quite fun. Cedars-Sinai out in LA has just launched its own accelerator program with Techstars. And so we're seeing hospital systems like running entire accelerator programs, bringing in interesting companies themselves, and like not needing to kind of go via the market and sort of find individual companies, but actually having a very structured approach to bringing innovation in-house. So lots of different interesting initiatives from these sort of three groups. One of the questions that we could be asking is who will win, who's got natural advantages? And the thing that was occurred to me when I was thinking about this question is, like, where do people spend their time? If we think about actually the money in the acute care spend significantly higher in the healthcare system, higher in residential, and then less in terms of the age tech space. It's almost non-existent. Unfortunately, I mean, Seth, I think, maybe here, but there aren't that many well-funded, successful startups that are sort of in age tech, and the consumer market is still emerging. On the other hand, if you think about the amount of time spent, amount of potential for services, significantly higher, compared to the amount of time that people are actually spending in acute care. So this could be one way of thinking about it. And if we think about the shift that happened in the internet advertising, this would be one way to sort of follow the money. But I think the real answer here is that we need a holistic approach. In order for June to stay independent, active, and keep buying her tomatoes, she needs the consumer tech world to work with the aging and the senior care space and healthcare to all connect. And really, this is what Avi and Ray were talking about when they said, can you come and talk about partnerships? And this is really what I think we as an industry need to do, is collaborate, to connect with each other, and not to try and win and own that individual themselves, but to create a holistic solution which is customer-centric. Okay, it sounds like a buzzword. The way that I think that we could start to explore these areas and things that I'm really interested in understanding is, firstly, how do we make this joined up, easy-to-use consumer experiences? It's really easy, and there's been a lot of great, it's not that easy necessarily, but there's a lot of great point solutions, but I think we're increasingly seeing there's really low point in trying to pepper that individual who's staying at home with 10, 12 different services, needing them to remember their logins and passwords, and having 12 different boxes that they all need to find different plugs. So this is an issue for us as an industry and as a system to make sure that we make it easy for that person living alone to have a joined-up experience. One example is a great little Dutch, Belgian company called Cubigo that is pulling those services together. This is not just about care. This is not just about clinical. This is about combining all the services: transportation, food delivery, somebody to cut the lawn and to paint the house, brought together in one easy-to-use interface. Second question, and I clearly don't have the answer to, but I'm still interested in, which is how do we measure the impact of these interventions? Because it's more than just one intervention that's going to keep people safe. The goal for all of us is just to have somebody happy, independent, and outside acute care settings. Even in the hospitals admit, the Geisinger CEO recently said, I want to close down hospitals. He doesn't want anybody in hospitals. If you think about it, our goal of society is keeping people out. But it's going to take a lot of different things to do that. In the UK, they had a recent program called the Whole System Demonstrator, which was the biggest telecare project, you probably know about it, where they had over 6,000 people testing all these different technologies and found some pretty interesting results with about a 45% reduction in mortalities. But there were some questions about the implementation of this, and the technology, frankly, was set up in 2006. So if you think about the technology between 2006 and 2016, it's a night and day difference, and I think CareKit would be a perfect example here. So that was just one intervention with telecare pendants. But how do you imagine the impact of all these different services, the food delivery, the transportation, everything that's needed? Because if you're missing one rung in the ladder, you're going to fail in the goal to have that person stay independent and happy and healthy outside a acute care facility. And the final question to leave you with is, how do we extend, this is probably the hardest one, how do we extend the healthcare business model into the tech and aging space? So if we think about the potential here, there's some really interesting work that's coming out of the UK around social impact bonds, which is a interesting topic. It's a bit unproven. There was a case recently in Salt Lake City which Goldman Sachs was involved with, where they would pay the provider a amount of money if the preschool kids did not need remedial education. So there was incentive for this project to keep these kids out of remedial education. This was the first social impact bond in the US that actually worked as advertised. And I think there's a huge potential for us to think through, if we as a broader industry, as the tech industry, as the senior housing community can do a really good job of keeping people happy, independent, healthy, and connected, then surely they should be part of the beneficiaries of that savings that accrue to the healthcare system. I know a lot of people are thinking about that, and I'd love to understand more as you guys have conversations for the the rest of today. I think I'm out of time. There may or may not be time for a Q&A. I'll leave that for you guys. But otherwise, these are my questions. I'd love to have conversations with you all, and thank you for your time this morning.
One or two questions. Any questions for the speaker?
Where's the coffee? The coffee's over there. Yeah.
What's the first step in moving ahead?
June Fisher. We need to speak to older people, figure out what they want. We can't be all sitting around in suits. I would love to have events like this, have half of the people in the room, older people getting engaged, really telling us what they need. And then it's much easier for us to then figure out how these solutions will work.
Hi, I'm Sarah Rigger. Here. I'm a PhD student at Karolinska in Stockholm, but I'm also a person with Parkinson's disease. I want to ask you a bit about how you see aging. Is it just a matter of age, physical age, because Parkinson's can be seen as a model of accelerated aging, and I had it very early. So would you say aging has only to do with physical age?
I would probably refer back to my initial comments about not being a geriatrician or a gerontologist, but being an innovation ecosystem creator. But I think your point, that if I sort of take it the way that I think you're going, which is that I think there's a lot here which is a universally important topic. There are so many interesting innovations that if we think about the needs of people, it's not just older people, it's people, for example, with dementia. I think are the most interesting group to design with, because if you can make a product or a service, especially a technology service and interface that's usable by somebody who's got impaired vision or impaired ability or cognitive impairment, they generally actually are also designing for scale. I mean, you just look at Apple and the amount of thought they've got into designing the usability of those products, and nobody would call those aging products, but they absolutely work. So I think we need, as a broad industry, to adopt an aging lens, and I think that can help us in product categorization. There's a group out of Singapore called Silver Group out of Asia, where they've actually created a little toolkit for companies to look how useful and relevant their products are for the aging market. And I think something like that, a lot of companies should go through to see whether they would fit. And I think it would probably work in your case too.
Thank you.
Last question.
You must be the tall Dutchman I heard about. Like we've got a photo op coming with people.
That's
over
a very
6'5".
good guess. Fortunately, 1 inch taller than Ray. So, thank you. This was an impressive lecture. We try to innovate in the Netherlands. I'll speak about that in a minute. I've become increasingly frustrated by randomized clinical trials to prove the merits of new interventions, particularly these complex ones. How do you measure the impact of an entrepreneur meeting an aging senior in their own homes? I was just curious what your idea is on how to prove, quote unquote, that something works so that we can then copy it to other areas or other countries, for example.
I think it's a great question. I don't know the answer to, but I would say two things. One, I completely agree from what I know about randomized clinical trials. A 5-year study on the impact of one intervention when you've got new companies can be like 5 company lifetimes right now. It can happen in 5 years. And you have multiple interventions at the same time. I would actually take that away and take the decision makers, take the people who decide what telecare system to use out of the project and out of the decision-making process and just say, you are innovators, you take risk and you decide together what is going to work. So I think what we need is an intermediary level connector, which can say, essentially it's a care plan that's personalized, and somebody says, okay, you've got dementia, you've got no family visiting, you don't have food in your kitchen, you need this kind of personalized care plan, and that's going to involve a bunch of different services. And it's not just about one service, but then the intermediary will start to become really good at knowing, well, if you've got this kind of intervention, this kind of disease, you need this kind of issue. But we don't even have the terminology to describe what is the intermediary to connect the conditions of the person with the range of services. And that, I think, is something that is worth thinking about. That's all I can say.
Yeah. And at the same time, there's a huge challenge to also prove the scientific merits of these approaches. Because, for example, Fitbits or false detectors are being pushed and introduced into the healthcare market. But if you go back to the original science, there were 10 healthy young controls who threw themselves down on a mattress, and now I have my falls detector for the elderly, which is not good science either. So there's a big challenge here still.
We have in our one of the investments we have is an Active Protective, which is a company in Pennsylvania, which is an airbag for the hip. It's one of the favorite ones I like talking about, because you have these awesome videos of not older people testing it, but like robot dummies testing, and it's like clearly hip fracture is a huge issue. And they've actually got some really good science, and the good thing is that they partner with Genesis in order to take it into their communities and have real-world data, because I think there's only so much you can do with the sort of academic relevance. You have to get a corporate CEO to get behind it and say it works and make it part of their marketing vision, rather than just rely too heavily on the science. No, apologies to all the researchers and scientists in the room.
Okay, Steve, thank you so much for outstanding presentation.
Thank you.